Yes, good evening, friends. My name is Paul Muliamboga. Once again, I am from Doctors on Mission. I have the privilege to serve children here at Holy Innocents Children's Hospital for the past 3 years. It has been an amazing journey. I am so humbled to be here. I am married to one beautiful Caroline, and we have 2 children. That is a little bit about me. It is the second of these discussions that we're having. The previous one I was talking about Doctors on Mission and about the upcoming camp that we're about to have. Today, I am more than privileged to welcome you to this session. We have a visitor who has joined us for the first time, but has been with us since the inception of Doctors on Mission. He's our patron, Dr. Mike Chewalyanga, but also is the head of all medical programs in the organization. He's a very passionate person when it comes to children, but he's more passionate when it comes to community-based healthcare. So right now, join me as I welcome him. He's going to introduce himself to you, and then we shall kick in our discussion, and we are going to be in position to start the evening. Thank you so much for joining us in this discussion. Yes, Dr. Mike, you're most welcome to speak to us.
Thank you, Dr. Paul.
Yes.
Thank you for the warm introduction. As he has introduced me, I'm grateful. I'm Dr. Chewalyanga Mike. I am a pediatrician, and I work with Holy Innocent Children's Hospital, and I'm the patron of the Doctors on Mission International. I'm very glad to share with you all. Thank you.
Wow, what a wonderful reception. It is always a privilege to have your patron join you. He's a very busy person, but having him even just for a short time is more than privileging for us. At the end of this month, we are going to be in Gulu. Gulu is so many kilometers far away from here. We have a partner, Amigos Internacionales, who have invited us to join them for a 3 days medical camp. And in this camp, we are going to be seeing all sorts of people, children, adults, and several other people. Today specifically, we want to dive straight into the medical field. Why are we doing this? And what are we looking at achieving by moving to the community? Anyway, when we move to any community, what is the aim of us going there? Those are so many questions that we want to answer. But before we go there, let's get to have a picture of who is Dr. Mike and what inspires him to do what he does. Yes.
Yeah, thank you, Dr. Paul.
Yes.
Yeah, as I've said, I am a pediatrician. A pediatrician is a specialist for children, and I've been a specialist for the last 5 to 6 years. And in general, I've been working with children almost, it's coming to 9 years as a qualified doctor, medical doctor. So initially, I worked with a children's hospital, Holy Innocent Children's Hospital, as a general practitioner for 2 years before I went back to specialize. And there are some drives that made me do pediatrics. They stem way back in my medical school. And also in addition to when I was a child, I grew up looking at a child as a vulnerable creature who needs to be assisted. Children are not small adults, and so they need to be assisted to step up, to move up. Seeing a child suffer, most of the events that go on, a child is stepped on, a child has rights, sometimes they are stepped on, and they need an advocate. That inspired me to become an advocate for the child, treat the child, see a child move, one who comes in very sick, moves out smiling. The parents are smiling, the community is smiling, and the country at large is smiling. If we have a healthy young population, we shall have a healthy future generation. So part of my inspiration was seeing a child who is suffering and looking at that child get a better life the following day.
Wow. That is so inspiring for me, and must be for you as well. And as we dive straight into it, we are going to be hearing more of this. Is it important for a doctor to think about the community? is it important for us to actually take healthcare closer to the community? Is it important to actually hold a medical camp in the community, or we should just wait for the patients in the hospital?
Really, the community is where all of us come from. And if in the medical teaching, if you want to understand medicine, go to the community. We who work in the hospitals, we may not really appreciate what the community holds, but conditions begin with the community. They have their own ways of interpreting conditions, managing them. They bring the cases that have maybe failed in their own ways. So reaching down to the community, to work with the community people, understand them, learn them, help them, use the little resources they have. We assist them as Doctors on Mission International will be very helpful. So extending these services to the community is really key, because there are many suffering there, but they cannot access the health care. It's an opportunity to them to get access to the healthcare services. And it's also a learning process for us. It's a learning opportunity to learn the communities, to understand them, and to work with them, to help them use the little resources they have in order to make healthcare services better.
Wow, that is very amazing, and I am so much inspired for that. He motivates us every day, every time we move out to the communities. In your experience as a pediatrician, what are the common cases that you have seen in the communities that you have visited, whether on a medical mission or individually, or calls that you have received and consultations that you have received? What are some of those common conditions that you see every time you move out to the community?
More than 75% actually will be respiratory illnesses. Child is coughing. Different causes can make children cough. We may not go into details of that, but respiratory conditions are the commonest. There are others, children born with disability, they are being abused, they are being neglected. Children having other conditions, it could even be cancer. There are other infectious diseases like malaria. They are living with them, poorly treated. Some of them got complications out of the previous illnesses. Children born with abnormalities, being neglected, not taken care of. And more so, communities suffer several things. It could be hygiene related, infectious causes, even the environment they live in. Some of them are subjected to trauma. You could also have snake bites. And there are others who live with children with abnormalities that could be genetic. They think maybe the child was cursed. They are misinterpreted. And these children have to be repatriated, rehabilitated, and assisted as advocates for health to these children.
Wow, that was priceless. As we go to this camp that is in plan, we plan to have a screening for childhood cancers. We have a team from Uganda Cancer Institute in Gulu that is going to join us for this camp. Is it important for us to screen for childhood cancers? And are they even common? Are they even important for us to screen?
Oh yeah, childhood cancers have been with us. There are some people who think that cancer is on a scourge. It has increased. In reality, it has not increased. Cases have been there, but undiagnosed because of the knowledge, the awareness. And so going with a team from Uganda Cancer Institute and the qualified healthcare providers to identify these conditions will be key. The cases are there, and we believe we are going to find them. It could be the liquid cancers like leukemias. It could be the solid cancers. The child has what they've been calling maybe a wound, but in real case, this wound is cancerous. A swelling, they think the child is disabled. Yes, maybe was bewitched, or other associations. And for us, we are going to evaluate the child and see whether it is cancer or not. So we greatly thank the team from Uganda Cancer Institute for coming on board with the Doctors on Mission International to help and screen these children from deep down in the communities.
Wow, amazing. We're blessed a lot so much for that opportunity that we are going to have. In addition to all that, we are also going to be having nutritional rehabilitation. We are going to assess children for nutrition assessments and also link them to care where in the facilities that are near to them and give them the best of the advice that we can. What is it that we should be on the lookout for children in nutritional assessment?
Maybe to give a background, Uganda, we are still a developing country, though with our government, we are at least progressing to becoming a middle-income country. Maybe with God's help in the near future, we are going to be there. So with all those fights, we still have issues of poverty. Some families still go hungry. Some children are still experiencing cases of child abuse. They are denied food. Families are unable to settle. We still have unsettlement. For example, in Gulu, where we are going, not many years ago they were experiencing the war. Only that now they are repatriated, they are able to plow, some of them are able to make a living. We expect cases of malnutrition to still be prevailing. And so we are going to assess these children, we are going to examine them, involve their parents or the caretakers, and we are going to use the standard tools and find the best solution for these children to be assisted to nutritionally become stable.
Wow, amazing. We're having a team of about 50 medical personnel. These are nurses, some are midwives, some are medical general practitioners, medical doctors, some are pediatricians, some are surgeons, others are volunteers who are coming on board. And we're also having other teams that are joining us from Uganda Heart Institute, as Cancer Institute, as I mentioned earlier. For each of these personnels who are coming, which message do you have for them as they come to go and serve people in the community?
I would like to urge these medical personnel. I know being a medical professional, it's a calling. And many of them have drives and inspirations why they became medical professionals. And so they should not forget that calling while going to the community. Let them go. They are not going to work for money. They are going to serve. They are going to serve God. They are going to serve the people. They are going to serve the public, their country, their countries where they are coming from. And the main goal, the main objective is to reach out to the community and assist this community. The community may have its abilities, but the little hand that will be added to them during those days of the camp will be very, very helpful to the people of that community.
Wow. And once again, whenever you reach out to the community, you are reaching out to God's people. And being given such an opportunity to do so is so priceless for us. That's why we thank the team from Amigos Internacionales for joining us and inviting us to be a part of this camp. Which message do you have for the partners who are sponsoring this, who have made all this possible?
Yeah, maybe mainly is to thank the partners from Amigos and others. We gladly thank you. The government thanks you for the work that you're doing. And as an advocate for children, we who take care of children, we really thank you. The community appreciates wherever we visit them, and the services are actually recognized. There is evidence. There are traces that really great work is being done. Please continue with a good spirit, the selfless, the unwavering services that you are offering. We are really glad as the community.
Wow. There is nothing more that you can hear from something like that. We bless the Lord so much for an opportunity to sit down with our patron. But before we close this discussion, I want to give him a minute or two to share with us a personal story of an inspiration, a child that he maybe has seen in the past, or a case that he has seen that maybe has challenged him as a person, but he has seen a child being transformed from a point of death to a point of life. I want to give him that opportunity, then we shall close.
Yeah, thank you so much, Dr. Paul.
Yes.
Yeah, one case in point is this mother who had 7 pregnancies. 6 of them were all lost before 20 weeks. And this time meets a specialist, a fertility doctor, upon referral from several levels, that maybe this is a doctor that would help them. And this is a mother who had never seen a child live. Because the child lost below 20 weeks, really you don't expect life. The baby is born is a premature, structures are not yet formed. So this mother was always hopeful to look at a child that is out of her womb. She had failed on several occasions, and this time she had even started luring other women to take up her husband, that maybe the husband can get the opportunity of seeing a child, even if this child is from another wife or another woman. And in this case, the 7th pregnancy, she's in the hands of the fertility specialist. She carries on, she sees herself go beyond the 20th week of gestation, 21st, 22nd, 23rd, to the 24th. She says, oh, I think I'm going to make it with all the help. She's there sleeping after supper. She feels something going through her night dress. And guess what? This was blood. She was getting a threatened abortion. A miscarriage was going to happen. She calls her doctor. It was late in the night at around 1 a.m. When she calls her doctor, I received also a call from the obstetrician who was taking care of her to be on alert, wake up, inform my team. I called the ambulance team. We went to theater. We received the baby. I received a very little premature who was a young boy. And we carried the baby on oxygen in an ambulance, took care of the baby. The baby got almost all complications that you would expect of course, except the permanent ones like retinopathy of prematurity, the necrotizing enterocolitis. The baby fell to toilet feeds. The baby would get severe anemias requiring transfusion, would get platelets down. The mother spent 3 months in the hospital. She became hopeless. She lost all the hope. She became helpless, except the husband. She had to sell what she had in order to support the husband. Family members, of course, abandoned her. Many of them had words. We told you you'll never carry a baby, but now you are insisting you are going to leave that baby as a dead body in the hospital or carry the baby with you as a dead body. She kept on being patient. She used to cry day in, day out. But as we approached the 3rd month, she started developing hope. This is a mother that would even have a diary. She would write the kilogram body weight gained per day, and every day the baby would add on weight. She became jollier and jollier. And she kept on informing the husband, please work harder because we are going to live here with our baby. 2 weeks towards the end, this baby now got a pneumonia, hospital acquired. She knew that was the end of her. But later on, the baby recovered, and as we are speaking, the child is coming actually to 3 years. Wow. A very handsome boy.
Wow. Wow.
This is a miracle to the family.
Wow.
Unfortunately, they've not had any other baby so far, but this is like hope. This is life in this family. They are jolly. When you find the baby has actually started school this year. And the day the baby put on the coat, the bag, the school bag, they had to take a photo to send to their doctor to see who this baby, the joy to the family, is looking like on the first day to school. So that story inspires me, because sometimes you don't know what God is planning for you. You may think this is the end of the world, but God has a plan for every one of us. God had a plan for that family. Despite all the struggles they went through, this is a handsome boy who doesn't have actually any abnormality. The eyes are okay. The boy is hearing well, he's growing well, he's very intelligent. He has gone through milestones well now. So every day I wake up, I'm inspired to go and save a life out there. It doesn't matter how deep in the night you'll be woken up by a phone call from a mother, as long as what you're doing is God's work, as long as you are saving a life. Carry on, move on. The rewards are there for you. They may not be tangible, but God is the overall controller of all of us. Thank you.
That is priceless. That is beautiful. That is wonderful. Thank you so much, Dr. Mike, for sharing that story. That is a story that he never shares, but we thank God so much that on this platform, he has been able to share it. We are more than privileged to the Almighty God for giving us an opportunity to share our skills in the community. Even if we had so many skills and we do not have partners on board, we would not be there in the community. We thank God so much for an opportunity to move to the community and to share. As a hospital, Holy Innocents Children's Hospital, we have had several of these outreaches in southwestern Uganda, but now the fact that we have this association of doctors coming together to do this work in the community in Gulu, it is more than privileging. We bless the Lord so much for that, and we are more than humbled for the story of our patron. Tonight, as we close this, we know that God has a plan for you who is watching. You never have to give up. Just as the story has shared, God has a plan for you. We have seen him work in the past. We have seen him changing life and transforming lives. You may be a mother and you do not have a child yet. You may be a father and you do not have a child yet and you have struggled with it. I'm not saying you are going to get a child tonight, but I'm just saying have faith, have hope, because God is faithful and he never fails. Even as we go to the community in the Gulu, we know that God is going to lead us. We know that God is going to impact that community as we serve those children, as we serve the women, as we serve the adults in that community. Thank you, Amigos, for making this possible, and thank you every other partner who has come together to make this possible. I want to thank every volunteer, every medical personnel, every nurse, every person coming together to make this possible voluntarily. We bless the Lord for this opportunity. Thank you, and thank you so much.